Point of care technologies, it's what you see when you go to the point of care, when you go into the clinic or see the doctor. So the technologies that are right there at the bedside.
We don't want to engineer a device that suits us well, but is not really going to solve the patient's problem. And this is where clinicians are so critical. Without their input, without their guidance, the engineered device may completely miss the mark.
How do we take research? How do we take advances? And how do we make them into technologies that can help patients? The Health Innovation Point of Care Technologies Conference is focused on that.
It's meant to get together the clinicians, the scientists, the engineers, those who are dedicated to manufacture and commercialize some of these technologies so that there is a clear understanding of what the need is, as well as what the new solutions might be. What are the challenges? And get each one of these parties to talk.
The exciting thing about HI-POCT for me is the HI part. It stands for healthcare innovation. And health innovation is how we do better in medicine. It's how we get better outcomes, lower costs. It's how we achieve what people want.
This will be an in-person meeting. Even though we were able to do a lot of things and continue to do a lot of things remotely, there is probably not a good substitution yet to what having somebody in front of you or maybe 2 or 3 people discussing. There will be plenty of precautions so that it will be a safe meeting, but it will be an in-person meeting.
Houston is a very exciting area for medicine and medical technologies. We have the largest clinical facility in the world.
The Texas Medical Center has been known as a mecca for healthcare for decades. Last 10 years, there's a significant development in Houston, especially promoting translational research. We have right now more than 300 life science companies, several very well respected healthcare institutions for medical school. So this is the perfect location. This is going to be held in the new buildings of ENMED, which is an engineering-based medical school.
ENMED is this new concept, blending engineering and medicine. And in particular, we're talking about doing this with medical school students, where you get an MD, but in the same 4 years, you're getting a Master of Engineering degree in the design and implementation of medical technologies. We're talking about producing this invention-minded doctor that's literally doing both simultaneously.
It's a partnership between the College of Medicine at Texas A&M University and the College of Engineering at Texas A&M. And Houston Methodist Hospital, the #1 hospital in Texas. And if you come to the Point of Care Technologies Conference, you'll see our facility. You'll see our makerspace. You'll see our problem-based learning studios.
We need to really collaborate, right? That is why this HI-POCT meeting is important, because that's when you start having this cross-communication and this collaboration.
Having the involvement of clinicians, having the clinical component be an audience as well as a contributor enables us to be better at what we do. Physicians are very good with putting up with problems, and they don't even label them as problems. That's just the way they practice. Now, engineers come along every now and then and they say, this hurdle doesn't have to be here. There's a way to improve that.
The main goal is to engage the community so that they can find new collaborations, new meaningful partners. And the most important goal is to make the difference, to plant the seed of what the future technology will be and to make that seed grow so that we can improve ultimately patient care.